I am Dr. Sriram Ramalingam, eye surgeon. I have more than 30 years of experience. I am the medical director of Pradnya Nethralaya, located at Atinagar, Bangalore. Cataract. What is cataract? In the eye, there is a natural lens which we call as human lens. The lens is made of proteins. This lens helps in focusing the rays of light from the outside source onto the retina. The retina then converts the rays of light into electrical signals, and these electrical signals are transmitted by the optic nerve to the brain. So the eye is basically a receiving station. The brain is the main processor and we see through the eye. When the human lens becomes opaque, we call this condition as cataract. Cataract is the most common cause of reversible blindness. Cataract occurs because of aging process. Just like the hair on our head turns gray as we start getting old, so does the lens inside the eye, which is made up of proteins, also turns gray. This is a gradual process. So it passes through various stages. You may have what is called as a nuclear cataract, where the center part of the lens gets affected, or it is called as a cortical cataract, where the peripheral part of the lens gets affected by cataract. When the cataract is not treated, it passes through various stages. We called as nuclear cataract can be graded according to the density or hardness as grade 1, 2, 3, 4, which depends upon the color and the hardness of the nucleus. Cortical cataract also passes through various stages. Initially, it must be a minimal cortical cataract. As the cortical cataract progresses, it may lead to a condition what is called as a mature cataract. If this mature cataract is not operated, it can lead to what is called as a hypermature cataract. What happens in hypermature cataract is the cortex starts becoming liquefied and the nucleus that is present in the center starts shrinking. If here again the cataract is not operated, liquefied cortex starts leaking out of the cat lens, and this leads to a condition what is called as glaucoma or what is called as lens induced glaucoma. So hypermature cataract is a complication of not having undergone cataract surgery, which leads to complications which can lead to what is called lens induced glaucoma. Lens induced glaucoma causes severe pain, redness, watering, and as the pressure remains high, it can damage the optic nerve which carries the impulses to the brain, and even it can lead to irreversible damage or loss of vision to the eye. So cataract, as I told you first, is the most common cause of reversible blindness. If this cataract leads to hypermature cataract, it can lead to irreversible blindness. So one should not allow the cataract to reach a stage of hypermaturity and go to these complications. The decrease in vision is the important symptom of any cataract. So if there's a decrease in vision, kindly get your eye examined by an ophthalmologist.